I am Professor Dr. Ala Abdo, Professor and Head of Tropical Medicine, Faculty of Medicine, Alexandria University.
I am Dr. Mustafa Yakoot, Consultant Physician, Epidemiologist, and Clinical Research Consultant. We are going to present summary of our original research titled The Very Rapid Virologic Response and the Early Hepatitis C Virus Response Kinetics as quick outcome measures to compare efficacy and as qualifiers for response-guided therapy.
Hepatitis C virus is an enveloped virus that belongs to Flaviviridae family of single positive stranded RNA viruses.
Early on-treatment virus response kinetics was a good predictor of treatment failure when it was around 50% in the pre-direct acting antiviral drugs era. Those who did not achieve an early virologic response were at high risk for treatment failure, and this provided the basis for the stopping rule at week 12.
Now, with lower failure rate, over 90% sustained virological response 12 rates, achieved with directly acting antiviral protocols, the early viral kinetics become better prediction for treatment success rather than failure. The very rapid virological response, undetectable serum HCV RNA level at week 2 was found to be correlated with the final sustained virological response 12 with dual sofosbuvir ribavirin protocol with a very high positive predictive value but lower negative predictive value.
It was also observed in many studies that combinations of highly efficacious direct-acting antiviral drugs that had higher than 90% sustained virologic response 12 rates in clinical studies for 12 or 24 weeks failed to have similarly high cure rates when given for shorter durations, especially in cirrhotic patients.
Given these two important observations, we hypothesize that there should be a sufficient time spent on treatment after serum viral negativity for the complete eradication of the virus from the liver cell and other reservoir such as platelets, mononuclear cell in blood, or reticuloendothelial system like spleen.
Thus, the speed of virologic response could be regarded as an important efficacy marker as it combines both factors, the bioactivity of the drug and the time factor as a denominator, where the speed equal the displacement over the time.
We are evaluating the validity of the speed of viral load reduction, very rapid virological response rate, as a quick endpoint for comparison of efficacy. Also, we are testing whether very rapid virological response can be used as a qualifier, shorten the course of dual sof-riba to be only 16 weeks instead of 24 weeks.
The study objectives were to present a new model for a fast-track comparative efficacy research where both the speed and the size of the effect of two treatment on virus load within just 2 weeks of therapy are used to compare the two generic sofosbuvir products, Gratisovir versus Grateziano, as a dual therapy protocol with ribavirin in chronic hepatitis C virus infection.
To evaluate the positive and negative predictor accuracy of the very rapid virological response as on-treatment marker for comparative efficacy and as a qualifier for shortened response-guided course of therapy.
The study protocol, 50 consecutive eligible chronic hepatitis C virus infected patients were randomized to either one of two generic sofosbuvir products, Gratisovir versus Grateziano, in a daily dose of one tablet 400 mg plus weight-based ribavirin.
At the end of week 2 of therapy, patients who had very rapid virological response were randomized in a 2 to 3 block into either 16-week or 24 weeks treatment. The rest complete the 24 weeks duration.
This figure shows the virus response kinetics curve at 4 time points. The baseline log virus load showed a similar markedly significant reduction in both groups by more than 5 logs at the end of week 2. Further smooth reduction occurs till the end of treatment, and then very slight elevation in the period after the end of treatment in the follow-up period for 12 weeks. The repeated measures factorial ANOVA test showed no significant difference between the two drugs at 4 points. The overall sustained virologic response rates by the intention to treat analysis was about 92%, while the per protocol analysis was 95.8%. And 2 cases dropped out, that is, say 4%, and 2 cases relapsed after the end of treatment.
The very rapid virological response 12 rate per protocol in each drug group show equal result.
This table shows the very rapid virologic response as a predictor for the sustained virologic response 12. It has a positive predictive value of 100% with confidence interval from 90.8% to 100%, and a high sensitivity of 82.6% with confidence interval 68.6 to 92.2%.
The sustained virological response 12 rate per duration of treatment in the very rapid virological response group, either 16-week group or 24 weeks group, both are show equal results.
In conclusions, the early HCV response kinetics curve and the very rapid virologic response rate to the dual sofosbuvir and ribavirin therapy could be used as sensitive, quick outcome measures for efficacy in the accelerated comparative efficacy research, with a very high positive predictive value and a high sensitivity for predicting the sustained virologic response 12.
The very rapid virological response might be used as an on-treatment qualifier for personalized course of therapy. This could shorten unnecessary long treatment course in rapid responder and might help to avoid relapse in slow responders.
Given that dual sofosbuvir and ribavirin plus or minus pegylated interferon was found to be the only treatment protocol associated with the development of 0% special resistant associated variants after the treatment failure, and given that from our results and other colleagues' observations, the treatment failure or relapse is very unlikely to occur in the subset of young age groups of chronic hepatitis C virus genotype 4 who has no or minimal liver fibrosis, MEDAVIR F0, F1, normal or mildly reduced platelets and serum albumin, normal or mildly enlarged spleen, whether treated with 24 or even 16 weeks of dual sofosbuvir ribavirin. So we recommend to keep dual sofosbuvir ribavirin as an option in the armamentarium to treat such subset of patients. This could diminish the rate of development of high prevalence of resistant associated variants to other new powerful combinations of direct acting antiviral drugs and preserve their effectiveness for more difficult to treat cases as long as possible. Thank you very much.
Thank you.